Are you a nurse or a nurse practitioner student who is struggling to figure out which specialty they fit in as a nurse practitioner? If you've had this question before, this video is definitely for you. I typically go through my comments to, one, see what my community is asking as far as information is concerned. And I got a question that says, I'm having a lot of trouble trying to figure out which specialty I want to choose for my nurse practitioner program. Any advice? And I'm paraphrasing that, but I'll put the question up here on the screen for you guys. And I wanted to shed light and give a little bit of advice on what I would do, again, if it was me, just to try to figure out where I want to land as a nurse practitioner, what kind of questions I ask myself, and what things I looked at as far as experience is concerned. And I know how pressing this question can be because choosing a specialty can literally define your nurse practitioner journey. Not always, so this feels pressuring, but I think if we walk through a couple of things and we break down in this video actually how to do this, I feel you will leave this video saying, this is easier than I thought, or I was making this a little bit harder than what it needed to be, right? Sometimes this can feel pressing, but I think there's a way to do this where you don't have to feel pressured. But I also know that because you have to determine a major and where you want to go, that this is some of the things that you have to think about prior to applying. And then some of these things you can learn along the way. I think you can change your major in nurse practitioner school, if I'm not mistaken, with your master's program. Some you cannot, especially if you are doing critical care, or I know some of these things you can get post certificates with. So you can also think about those things. But let's start this video off and jump right into it. So y'all are probably thinking, girl, who are you to be able to tell us or to talk about how to choose a specialty for nurse practitioner school? Well, for one, if you're new here, my name is Bree. I'm a board certified family nurse practitioner who has worked in 2 specialties. Actually, since I had three. The second one might not necessarily be a specialty per se, but I would say at least 2 that I have worked in and thrived in, and I've never been in primary care because that's not somewhere I see myself being. But I've been a nurse practitioner for almost 6 years now. Started out in specialty. I'm still in specialty. So I feel like I have a little bit of skin in the game to be able to talk about this. Before I became a nurse practitioner, I was a nurse for, I believe, 6 or 7 years. I've been a nurse for almost 6, and it's been a long road and a long journey. I'm actually a GI nurse practitioner currently right now, fully remote. And so I got a little skin in the game to talk about this. But let's talk about GI was not my first specialty. And I started out in general surgery and also thoracic surgery, which they work together. So this is why I feel like I can speak about these things. And I get this question a lot about, how do I pick a specialty? How can I figure out where I want to go, who I want to be, where I see myself in the next 5 years? And the short answer to that is that only you can answer that. Right? I will walk you through my thought process and how I came up with these things or where I wanted to go. And I think the first thing really is Xing out what you don't want to do, where you don't see yourself being. And with that, I think we can start to build a list of, these are things that I start to see myself in, and how do I get to that point? So before I give you my breakdown and my framework, let's talk about one of the biggest mistakes I feel that nurses or new nurse practitioners make when they are trying to choose a specialty. I think that when we see a lot, healthcare is very prominent on social media now. So we see a lot of people talking about their specialties, what they like to do, the money that they make. And I think once people figure out, oh, I can make this amount of money doing this specialty, they latch on to that. Right? Instead of choosing a specialty where you will thrive, right? So if I know that I thrive in critical care, but someone is telling me that I can make upwards of $150K and over doing Psych NP, and I choose Psych NP, but I really don't love it, you're going to be miserable. And that is the first mistake I typically see people make when it comes down to choosing a specialty, choosing where they want to work. So I think when we start with that, I would say not to do that. You'll be miserable in the long run, and you might find yourself having to do a certificate for what you really wanted to do in the first place instead of following the money. I always tell people to follow their passion because their passion is going to lead to you to the finances anyways. But also we are talking about people's lives. We are diagnosing and treating and things like that. And so we don't want to just be running to the money because the core of this is taking care of people. So if you cannot take care of people to the best of your ability in the specialty that you chose, I would say to go the other way. And let me just share a quick story about my own self and why this framework that I used to pick a specialty helped me. When I was in nurse practitioner school or in nursing specifically, I thought, I wanted to do women's health. I loved the topic. I wanted to be in the position to help women, especially as a Black woman, and Black women's health as well as maternal health being looked over. I just wanted to be a part of helping women, especially Black women, right? And when it came time for me to do my nurse practitioner rotation for women's health, first of all, women's health was the hardest rotation that I had to find. And I ended up having to pay for it, which is maybe had some bearing on my experience. I don't know, but I did have to pay for that rotation, $1,500, which is absolutely insane. But it was finish school or don't. And by that time, I was ready to be out and I just wanted to be done. But I literally had to drive. I couldn't find anybody, no nurse practitioners or doctors or anything like that who would take a student in my area. So I literally had to drive. I drove about, I want to say 50 minutes each way to an OBGYN office that I was able to find. And again, like I said, I had to pay $1,500. The doctor was a male. I'm not saying that that has any bearing on the experience, but I'm just giving you the details. And there were multiple students there, so that was a red flag for me. And sometimes there are multiple students that are at these rotations, so it doesn't mean that that's a bad thing. But I wanted to figure out how is everybody going to split up and have equal amount of time to learn and maybe do procedures and things like that. So it was at least two of us there at the same time, which I feel is, especially if you have a full roster of patients, you can split them down the middle. You look up the patients, just get started. The doctor was not interested in letting us do anything. And I'm not saying that right out the gate we need to be doing procedures, doing pap smears or anything like that, or none of that stuff. Not saying that. But at some point along the line, you start to learn who your nurse practitioner students are, what skills they possess, what they can do, what they can't do, and you may let them do a thing or two at least. He didn't let us do anything. When we went in to talk with the patients, it's like that. I think he might have let us get the history, maybe get the chief complainer while they were there, so that helped with assessment skills. But as far as coming down to it, to assess the patient, do pap smear, I think we did urine tests for UTIs, we did pregnancy tests, and we held the swabs for him to be able to swab for the pap smear. But I think that was just about it. On top of that, when we would ask him questions, he would say, you look it up and you tell me. And there was a lot of other things that went on in that space, and just us being treated like a number because we paid and not students who were there to learn. And for me, I didn't really get what I thought I was going to get from that rotation. And so that kind of deterred me from wanting to be in women's health because I didn't really get to learn anything that goes into it. I also didn't work women's health as a nurse. Sometimes that's all encompassing with certain things, but I really wanted to use that nurse practitioner rotation, that OBGYN rotation, as a time to see if this is really for me. I may want to do it, but is it going to be my passion? Is it something I'm going to thrive in? And for me, after the lack of learning and then just being in that space, I was discouraged and I really didn't do it. Actually, on the flip side of that, maybe it was God sending me a sign that this wasn't the way he wanted me to go, because I never did women's health and I'm okay with that. And I don't think it's where I would have ended up, but I needed that experience to be able to mold and shape me to say, hey, you didn't even learn anything in here. So let's get our hours. You learned what you can learn. I felt like I was teaching myself, the students there, we were teaching each other, quizzing each other, doing a whole bunch of stuff. And so for me, I just was like, this is where we're going to draw the line. And for me, I don't think women's health was a specialty. I think the rotation had a lot to do with that, but it just wasn't for me, and that's okay. On the flip side of this, my primary care rotations, which I did too because we were able to double up for that specialty, I think for just overall health of adults or whatever, my primary care specialty and my pediatric specialty was amazing. They were both great. I had amazing preceptors. My primary care rotation I actually did with the same preceptor twice. She was a nurse practitioner as well, old school nurse practitioner from Alabama. She was amazing, still to this day. Love her down. She taught me a lot. She was always very welcoming, more like family. And then my pediatric rotation, again, loved that rotation. It was amazing, learned a lot. I was already working in pediatrics while I was in school anyway, so a lot of that stuff I kind of knew already, but it was good to get it from a nurse practitioner side and be able to see what would be different if you are diagnosing and treating pediatrics as opposed to doing that as a nursing role. So those were good. I walked away in that knowing that maybe I could do pediatrics. I already knew that I didn't want to do primary care. So even though I had a good rotation with that and learned a lot, and I know that I could thrive there, it's just not something that I wanted to do. And so that's the flip side of that. So the first takeaway I would say is to use your rotations as an experience. Learn as much as you can. And then when it's time for you to go, say, did I love it here? Or did I just like it? And do I see myself doing this for the rest of my life or for the next 5 years? Because you can always hop around jobs if you want. But do you see yourself doing that in the next 5 years? That way you can start crossing off if these specialties are for you, and you can do that from experience and what you learned and the things that you had to do skill-wise, as opposed to just choosing a specialty based off what you think you like or what you think you love and where you think you can see yourself. So if you don't have a gut feeling and you're still trying to figure out, hey, where do I start? I wrote down some questions that I want you to ask yourself, because I feel like we just do a little deep dive into ourselves sometimes, just to figure out what you want to do. Where do you see yourself? And I always start with, where have you thrived in the past? It's so crazy to me because, like I said, I worked emergency room and trauma and I loved it. I loved the thrill. The only reason why I stopped and changed as a nurse was because I was going back to get my master's degree and I wanted something that was a slower pace. And so I got a pre-op job, which is great, fabulous. And it was the perfect shift and all of that. But it was just a wonder that I didn't do that as a nurse practitioner. But I felt like after I experienced a little piece of heaven, which is the slow down, I didn't really want the hustle and bustle anymore. But I could have done urgent care. I could have done emergency room nurse practitioner because I had that experience. And so I always think about, where do you thrive? So think about if you're already a nurse, right? I'm hoping, I know a lot of people start nurse practitioner school right out of their BSN. I would highly not recommend, but I know people have done it and they say they've been successful. That's cool. To me, no. I think that you should have at least 2 years under your belt, at least. And I mean 2 years as a nurse. And I say this because you are now moving the needle from being someone who carries out the orders to the person who writes them, to the person who diagnoses, to the person who is treating, right? And so with that, there comes a different mindset. And I feel like you become a little bit more independent and working and figure out how those things goes, looking at critical conditions, how it affects patient population, all those things if you have a little bit more experience under your belt. But let me not get ahead of ourselves because that's not what we're even talking about. That's another video for another day. But think about, as a nurse, what units you worked at, what floors you work at, etc. And ask yourself, this is question number 1, where did I feel competent, not overwhelmed, right? If you always feel overwhelmed with your work and you just feel like you're just not grasping it, you're not just getting, to me that feels overwhelmed more than it feels, I'm competent and I got this. Basically, are you confident in what you're doing? Second question, where did time move fast because I was engaged? This is a good question, but I also feel like sometimes them 12-hour shifts be dragging depending on when it is. But sometimes you love what you do so much, time ain't a factor. So if you've been in a place or been in a specialty, whether that's labor and delivery, mother, baby, psych, whatever that is, and you felt like time really wasn't a factor for you, you're not looking at the clock trying to figure out when you going home, you can consider that, right? What patient population did I actually enjoy problem solving for? That's question 3. So ask yourself that. Do you like geriatrics? If so, you might want to be a geriatric nurse practitioner. Only do adults. Maybe your specialty, or you didn't really like the peds population, or wasn't for you. Or is this women's? Is this the mental health community? So think about that. Ask yourself that. Next, this is the last question I have. I only wrote down 4. Where did preceptor or attending say, you're really good at this? I think you might see this when you work very closely with attendings. For me specifically, it would have been pre-op and PACU, right? We work closely with them. We see them before going into surgery, talk with them, etc. We see them after. We might see them during the recovery period just because somebody is recovering from surgery, so they are rounding, etc. Sometimes people don't see doctors, maybe about once or twice a day, depending on what specialty you're in. So, for example, I work cardiac med-surg. I don't know how many times I actually seen a doctor be hanging out for real. We called them. Of course, I think they're all over the hospital and whatnot, but I don't think I've seen them much. So it might have to be someone who works very closely with you to say, wow, you're really good at this. Wow, your skills are out of this world. Wow, you know what I mean? So that might where you get that. I'll give you an example. For me, this is exactly how it played out. Again, told you I work pre-op PACU. And I love general surgery, love the doctor, love making sure their pre-op was set. They were able to get in and get out when it came to signing consent and briefing the patient, making sure they had all of the information, making sure my assessment was up to par. So because of that, in pre-op, I always talk to them. And PACU, same thing. I'm making sure they have stuff. I'm anticipating the needs of the patient, but also maybe what the surgeon would want based on how their workflow is, all of those things. So if you can anticipate the needs of the patients and maybe think about what the doctor would want and call them and say, hey, this patient is doing this. I remember you usually like to do this. Would you like to put those orders in? They love people like that, very independent, or they love people who ask questions and not just be doing anything, right? And so because of that, they took a chance on me, right? I was a nurse and applied. They told me, oh, we have a nurse practitioner position opening. We think you would be great for it. You should apply. You know what I did? Applied real quick. And then I took my boards, waited for licensure and all of that stuff. And they waited for me. They gave me an extended orientation because I didn't have any general surgery, actual hands-on experience. But it was a great transition. It was a great team. And it was amazing. So that's just how it worked for me. So that's why I give you those questions to say, hey, where do you thrive? Where do you see yourself? Where do the skills stand out? Where do you see yourself as confident? And then I think that's pretty much it. So for your homework, I just write down those questions that I gave you, but also write down every unit, every rotation that you had as a nurse practitioner, every patient population you work with. And then next to each one of those, I want you to write one word. You either write if you thrived, you write if you survived, or if you absolutely dreaded it. And then you can cross off the dreaded because we don't want to be there. You survived. Maybe you could have done things different. Maybe you see yourself there with a little bit more training, right? Where you thrived. Maybe this will come easy to you. Maybe those are the kind of things that you can think about. So because I don't want this video to be straight vibes, And I want to give you some framework to take on with that when it comes to, and I just got my notes here, when it comes to licensure, certification, education. I want you to understand certain things because a lot of people have this very pressing question, because depending on which program you choose, that program prepares you for that certain specialty and then also determines which board you're eligible to sit for. So I wrote this out on my notes just to make sure I'm saying this correctly. So let's see. For FNP, so family, for me, that's what I am. This is the broadest of the broad, right? We go from life to death, right? So that course curriculum, that is why we have to do pediatrics. That's why we have to do adults. That's why we have to do OBGYN or women's health. So you have those things because you're going from life to death and you need to know what's going on. There are some programs that allow you to do one semester of specialty. So maybe you wanted to do aesthetics or dermatology or something like that. You might be able to get one rotation under that belt with your program, but you would have to check and see if that is something that they allow. So you're trained to see patients, like I said, from infancy through geriatrics, and you might have the most flexibility in these certain settings. So primary care, urgent care, dermatology, GI, like me, if you have an interest in GI. And then sometimes people who are FNPs can get into cardiology. I know that because cardiology NPs sometimes also round inpatient, they might fare well or better with people who have acute care rather than just being an FNP trained. However, you might be able to be an FNP and do office cardiology. But again, this has to do with job description, state, and then also your certification and licensure. So you would have to look that up. Adult gerontology primary care. Young adults through frail elderly. So that is 18 years old. They don't see, and I don't even know, I think they see 18 years old and then, of course, on down, but no pediatrics, so nothing less than 18 years old. Chronic disease management, prevention, this is usually outpatient, but I do know some people who are in hospital as well. Adult gerontology acute care. So this is for complex, unstable, hospitalized patients. So maybe ICU, you could be a hospitalist, you can work in the ED, right? Pediatric primary care, which is what I already talked about, but this is infancy through young adulthood and outpatient pediatric settings. I've also seen them in hospital. So I don't think they are limited to outpatient at all. Neonatal, which of course we know NICU to level born newborn care, and then women's health or case gender related, so reproductive, gynecological health across the lifespan. And then of course we have our psychiatric mental health nurse practitioner. This is again across the lifespan, so you can do PMHNP as a peds person or adults or geriatrics. That could be your focus, but it's across the lifespan in outpatient, inpatient, and integrated care settings. So just wanted to have that so y'all can have that information. So I think sometimes people, because you had this question, it's just like, oh, I have to choose. And you do, because you can't switch back and forth. Or if you decided, oh, I'm going to do FNP and then I'm going to get a psych certification, you can do that after. A lot of people do it. Or if you wanted to do, I don't know if there's anything else that's easiest to go. I feel like family nurse practitioner and psychiatric is because I think that you can get a critical care, but again, I think a lot of those programs, and please don't quote me on this would be something you have to do your own research on, but I think a lot of those programs will want you to have the critical care aspect or that experience prior to you joining that program. I don't know if that's available as a certification or not. Again, don't quote me. Let's see, what do we have? So I think I said that. So after giving you that information of what specialties are what, again, those programs are specific and that will entail which board you sit for. So if you were in a, let's say, pediatric or PMP nurse practitioner program, you have to have these many certain of hours with the peds population to be able to sit for certification. That's why it's so important to know where you want to go. Now, flexibility wise, again, we talked about postmaster certificates. You still have to do the coursework, so you will have to go back to school and you will have to do more clinicals. I just want y'all to be aware of that. And of course, you still have to sit for boards again. So it's not just like, oh, yes, you'll be board certified. So you have to go through that again. Maybe you might not be interested in going back to school again. But if you are and you just don't know and you're like, let me see, FNP, I feel like it's the broadest thing that you could do. And then if you wanted to get postmaster's certification in something else like a psych or whatever, then you can do that. You would just have to figure out what that looks like for you. Also, I think FNP just gives you the widest range of flexibility, and you can train in different specialties if someone allows it. For me, I had general surgery, gastroenterology. Some people work in dermatology. They might have a training where they do aesthetics and they're in FNP. And so it doesn't take things off the table. So I just want you to be aware that you do have options. There is some flexibility, but once you choose certain things, maybe in acute care, which is different. The only reason why I keep referencing acute care is because I know for a fact that they ask you to at least have some experience for acute care. I believe 2 years or something like that. It may be different now. I don't know. I've been out that game in nurse practitioner school for a while. But so you have flexibility with FNP. And I'll tell you, I always wanted to work in surgery, but I told myself if I didn't do surgery, I wanted to work in aesthetics and I wanted to do FNP. And so that's the only reason why I know you have the flexibility to do those things. So if you just don't know, and even after you're going through your rotations, you still are like, FNP. And again, by the time you are going through your rotations, you already chose a program anyways. So you would have to be in something that's really flexible from jump unless you're willing to, one, change over, you meet the requirements for the other program you're going to change over to, and you may have to sit for more school, right? Or change up what your rotations, your clinicals are going to be. So it's just good to know before you get started so you know when to apply and what you're going to do, because I think most programs say you have to pick a track. You can't just go in and be like, I don't know, you have to pick a track. You may have asked yourself or told yourself, man, I don't have experience in that position. I can't get that position. I want you to stop talking to yourself like that. That's what I want first off. Don't ever say you can't do something or you don't have the experience. And I'm literally walking proof of that because I didn't have experience for general surgery, but they hired me. I did pre-anesthesia testing. Again, I work with surgery, so that's kind of adjacent. I didn't have much experience in GI. Did some of GI overlap in general surgery? Yes, but it was very surface. Someone took a chance on me and I trained. And some places will take a chance on you and train you. They might see all of your other experience and say, wow, she has the skill, she has the communication. I think that she could think quick on her feet. She can make decisions. I think this would be worth training. And they will extend your orientation, train you, and take a chance on you. It happens. It happens every day. It happened to me. So I think when we talk about adjacent experience on your resume is always going to be relevant because you were a nurse once and you'll be a nurse practitioner, especially if you have a strong background. I think people will take a chance on you and it will be fine. So I don't ever want you to count yourself out and say, I don't have the experience in this, I can't apply. You can apply, you should apply, because you never know what's going to happen. You never know who's going to say, you know what, I like this girl, I like this guy, I see what their resume shows, I'm going to take a chance, I want to interview them. You might walk out with a job. I think I touched on this earlier, but I want to also give you guys just some advice on choosing maybe elective rotations. So I mentioned earlier that there are some programs in schools that might allow you to do an elective rotation in place of something. So they might say, hey, you can do a dermatology, or hey, you can do an aesthetics, or something like that. And if they allow you to do an elective, right, and there's something that you want to do and you found a preceptor for it, get it done. And the reason why I say that is because that one elective rotation might make you be like, this is where I'm going to be working. And what I mean by that is, for instance, say your FNP program, right? And they allow you to do an elective clinical. And you say, I really like the skin, I want to do a dermatology rotation. And you have a dermatologist or somebody who's going to do your rotation. You need that experience and hands-on experience to say, you know what, after graduation, I only want to do dermatology. You know what that does? You can put on your resume that you had a dermatology rotation This is what you learned. You thrive. You can then make connections in that elective rotation, have that doctor or whoever took you under their wing to write you a recommendation for that job, right? Or be your recommendation for that job. Now you just set yourself up for success. So if you have an elective rotation option and you are able to find a preceptor who doesn't mind training you on something other than what the program is requiring you to do, take it. Use it, set yourself up for success, and then after graduation, you go for those jobs. So what I want you to take away from this video is to do a heart check, right? About where you've worked before, what your experience entails. If you chose a broader specialty like FNP, really honing in on the clinical rotations that you do to figure out where you best thrive or where you would love to be. Think about what your dream job was always, and then go from there. Think about where you've worked, where you felt the most confident. And I want you to know that according to the labor, and I think it's like the Labor Bureau or statistics, whatever they call themselves, nurse practitioners are the fastest growing career and will continue to be that. So I feel like there will always be jobs available. Of course, they vary. Different jobs come with different demands. They come with different pay scales. So just take note of all of those things. Do your research about your state. What am I thinking about? What their cost of living is, what their scale of pay is, because that's going to be the next video that we talk about pay in different states and how that goes. But definitely be doing your research. Make connections, talk to people, do all of that. And so I know I mixed up this video a little bit with just the rotations and you already being in a specialty as opposed to being a nurse and going and applying to nurse practitioner school and figuring out what specialty you want to be in. And I feel like the only way that you could jump specialties would be if you started in an FNP program and decided you wanted to do something else, or you do postmaster certificate for whatever else you wanted to do. However, as a nurse, these things still stand. You can still think about, the only reason why this wouldn't stand is if you're one of those people who got their BSN or got an RN or whatever the case may be, and then decided you wanted to go right into your master's program straight out the gate. You don't have anything to compare it to. So if you have experience and you do have something to compare it to, you use those things to compare it. So I hope that this really helped maybe jog some things in your mind, the questions that I gave and things like that. You can really write down your 5-year plan and where you see yourself and where you feel like you would thrive most in whichever specialty you're thinking about choosing. So takeaways, and I've sent this, just put my notes here. Separate your rotation experiences. I'm guessing when it means when you're finished with your, you can even think about your clinicals when you did for RN. It doesn't have to be you're already in a nurse practitioner program, but think about your rotations and where you thrive. That's the takeaway from that. So that's number 1. Number 2, look at where you think you want to be. What sounds great to you in the next 5 years where you would want to work. Understand the population and the flexibility, what it is that you want, what kind of pipeline. Are we looking at acute care? Have you always worked in ICU? Have you always worked psych, pediatric, whatever it is, look at that kind of pipeline. 4, I've said this before, please don't ever disqualify yourself, right? We are not building a community of nursing or nurse practitioners for that matter who are on this channel who are not confident in who they are. We don't speak ill over ourselves. We don't give negative whatever to ourselves. We don't do any of that because we can do all things. And so if you go in with the mindset that I'm going to be successful and I'm going to take a jab at this, even if they rejected me, I did it. That's the kind of attitude that we want to have because you just never know. You miss 100% of the shots you don't take. All right. So don't ever disqualify yourself. Last is use every bit of experience you ever had and just apply it. Make those connections, talk to people too. Hey, have you worked with me before? Where do you think I would best thrive? Think about it. So thank you guys for coming to my TED Talk, aka my YouTube. I love having you guys here. I love talking about nursing. I actually was like, let me just scale back a little bit because I can talk about this all day. But my main charge is always to help you all try to answer your questions as best I can based on my experience. I'm not always going to be able to answer every question, but I want to answer them all if I can. I want you all to be successful. I want you all to be great, to be confident, and to know that you can do this, and to know that the world needs you as the next nurse practitioner, the next nurse. And so I hope that you take something away from this video. Please, if you found this great, if you found this information to be amazing or useful, pass it on to someone else who might be a nurse, a nursing student, a nurse practitioner student, or a nurse practitioner. Please like and subscribe, share with all your friends, and stay tuned for our next video. Bye.